Hello, it's Professor Cornell again. This is Fluid and Electrolytes Part 2, Tape 6, and hopefully last. Okay, so we were on this slide. This is regarding veins that we use to insert peripheral lines. So there are different sizes of catheters when you go to insert a peripheral line that you would use based on the patient's size and what it's going to be used for. So the larger the catheter, the smaller the number. So 18 gauge is a pretty large catheter and is often used for patients who are having surgery or are expecting to get blood components. 20s and 22s are more commonly used, the more common sizes for adults, and these 24 and 26 are used with elderly and pediatric patients. Starting an IV is not a skill that beginning nurses are required to have. So when you start a job at whatever facility, if you need the skill, they will put you through a training of how to start a peripheral line. So this is not something that we will be teaching you to do, but I just want you to be aware that there are different catheter sizes and you will be responsible for monitoring the IV site. And you can, at that point, check and see what size catheter the patient has. So there are certain places where you do not want IVs to go. If their lymphatic system is not functioning, patients who've had mastectomies, often their lymph nodes have been removed and a lymphatic vessel has been damaged. So you wouldn't want to start an IV there because they may have trouble absorbing the fluid. And if they've had a stroke or for some reason they're paralyzed, you wouldn't want to start it in the affected limb. And you would never want to use, if there's a fistula or a dialysis graft, you wouldn't want to use that arm either. Infection control, this is CDC recommendations, and this is what we follow. Hand hygiene, instead of shaving, if the patient's very hairy, you would want to clip their hair if it's long. Make sure their skin is clean. You use chlorhexidrine is usually what we use, or alcohol. Of course, you'd need to wear gloves, and sometimes they have IV kits, IV starter kits, and this is what's in them. There's a tourniquet and all of the things that you need. A midline catheter, this is also considered a peripheral line. It's a little bit longer than these short catheters. Nurses can start these, but they need to go through a special training. They're inserted usually in the basilic or the cephalic veins in the upper arm. And they can last longer, up to 1 to 4 weeks. You cannot use them to draw blood. You do not ever use any of the peripheral lines to draw blood. Now, central lines are different. These are inserted directly into the heart, the superior vena cava, and they're always, after they're inserted, they get chest x-ray to make sure that they've been placed correctly. Peripheral inserted central catheter, it's inserted down in the antecubital space in the basilic, usually vessel vein, goes up into, and the end of the catheter is in the superior vena cava. Nurses can insert these if they've gone, but they have to be certified. Chest x-ray is always done. The lengths vary depending on the size of the patient, and they will document how long the line is so that when it's removed, they'll be able to verify that the whole thing has been removed. It hasn't broken off or anything. Yes, you'll commonly see these in at the subacute units because they're a little bit safer than the peripheral lines. So the non-tunneled percutaneous, this is directly into the subclavian vein and then down into the superior vena cava. A tunneled one is the same thing except for that it's in the subcutaneous tissue before it goes into the superior vena cava. These are for long-term. Implanted port, this is surgically inserted into the subcutaneous tissue, and you can't see anything, you have to palpate it. There are double and triple, all of these, there's double and triple and single lumen. There's a special needle that's used to access it. So from all the central lines you can draw blood, and they range from single to triple lumen. These are hemodialysis catheters. You would never use these for fluids or to give anything IV. They're always just reserved for dialysis. If you do have a patient with one, though, you need to listen with your stethoscope for bruits. Make sure that there's a good flow. So a nursing role for IV is to initiate the IV therapy, which you will, depending on where you work, you will go through a training to receive that. To maintain the solution and flow rate, you will be able to do this after this semester. Monitor the site of the insertion to make sure there's no complications for signs of inflammation or infection. You need to assess, this says every shift, but I believe it should be more frequently than that, every couple hours. If they're getting a continuous infusion, it needs to be every hour. You need to assess before and after every medication if the patient's complaining of pain or discomfort, and make sure that the dressing on the catheter is intact and the catheter is covered. Also, you want to monitor if they're receiving fluids. You want to make sure they're not having complications such as fluid overload. Nothing should hang longer than 24 hours. So even if they have a very slow running infusion, you wouldn't want it to hang more. You'd have to change the bottle. Okay, so let's talk about complications. Your book has many, many listed. We're going to cover 4. Infiltration and extravasation, phlebitis, and thrombosis. But there are many, many others listed. They can have nerve damage and spasms and others. So this infiltration is when the IV solution starts infusing outside of the vein into the tissue, and there's many reasons why this can happen. Signs are sluggish IV, edema, tightness of the skin. So this is for fluid that is not going to be toxic to the tissue. It can be absorbed and it's okay. You need to stop the infusion and remove the catheter. Apply a dressing and monitor for weeping, cold compresses, elevation, anything that's going to help with venous return. This is in a child's foot where they've had infiltration. Extravasation is the same thing, except for that the solution being infused is toxic and it's going to cause tissue damage. When this happens, you want to stop the infusion, but you do not want to remove the catheter because you may need to give an antidote that goes into that tissue. Phlebitis is when a vessel becomes irritated. You can see the vein here becoming irritated. It's inflammation. This can happen after the infusion, so it's usually related to the medication that's being given. They may have pain. It's red and inflamed along the vein, so you'll see a line of red. So you should remove it at the first sign. Use warm compresses. Let the doctor know, of course. Monitor it. And there is a scale, a phlebitis scale. It's in your book. I'm not going to go through that. And then, if it's a peripheral line, you need to it needs to be changed. If it is going to be there longer than 3 or 4 days, you need to change the site. Thrombosis. This is blood clot in the vein, and you will see swelling in the limb that the IV is on. So you should stop the infusion and remove the short catheter immediately. Apply cold compresses. They may need some medication. They probably will, and surgical intervention. So the interventions are to reduce the infection risk using a needleless system. Do not tape. When you go to insert the needleless system, you need to wipe the port 30 seconds with antimicrobial and follow hand hygiene rules, washing your hands and wearing gloves. What is the primary intervention the nurse can implement to prevent a central catheter-related bloodstream infection for a patient having IV therapy? The answer is A, perform hand hygiene. During the insertion of an IV catheter, a patient with dehydration reports feeling pins and needles in his arm. The nurse is aware that this sensation may be caused by, the answer is A, nerve puncture may have occurred. True or false? It is important to keep IV fluids infusing as prescribed. When fluids are running behind, the nurse should increase the rate until the infusion is caught up. This is absolutely false. You need to keep the infusion running at the rate that it was ordered. If it gets behind or ahead, you do not play catch up. If it gets ahead, you'll need to call the physician so that in case the patient gets into fluid overload. Which type of IV fluid decreases intravascular volume? This is asking you about tonicity. So what's going to pull fluids out of the blood vessel? Hypotonic. A patient with a sodium level of 178 is ordered to be started on 0.45% saline. So what is that? What is the most important nursing intervention for this patient? A, give slowly and watch for signs of cerebral edema. B, clarify doctor's orders because 0.45 saline is contraindicated for hypernatremia. C, maintain patent IV. Or D, give rapidly to ensure fluid levels are shifted properly. What is the most important? The answer is A, give slowly and watch for signs of cerebral edema. So if this patient has hypernatremia, you're giving a hypotonic solution to try and lower that sodium. But the chances that you could start pulling fluid into the cell because you're dumping all this hypotonic solution into the blood vessel, you want to give it slow and you want to watch for changes in the patient's mental status and neurostatus because there's always a risk for, drawing fluid into the cells, and that's a problem in the brain. A patient is being admitted with dehydration due to nausea and vomiting. Which fluid would you expect the patient to be started on? So if they're dehydrated for nausea and vomiting, you would expect an isotonic, which is D, normal saline. A nurse is assessing clients who have IV intravenous therapy prescribed. Which assessment finding for a client with a peripherally inserted central catheter requires immediate attention? The initial site dressing is 3 days old. You change the dressing every week, so that's okay. PICC line was inserted 4 weeks ago. No, that's within reason. A securement device is absent. That might be something for concern, but it doesn't cause immediate attention. Upper extremity swelling is noted. This you would be concerned about because that indicates there is some complication going on here. So the answer is D. Okay, that's it. That's it for our fluid and electrolyte part 2 lectures. Okay, thank you.